Good afternoon. My name's Simon Devaney. I'm a team manager with the Care Inspectorate. I'm here today to introduce our latest Safer Staffing bite-sized webinar. Today's recording will be in relation to collaboration with partnerships. And I'd like to introduce two colleagues who have taken the time and effort to become involved in today's webinar. So, Jamie, if I could introduce yourself.
Hi, I'm Jamie Smith, lead nurse for Care Homes and Care at Home for NHS Highland, working with Argyll and Bute and North Highland.
Thank you. And Donald.
Hi, afternoon. I'm Donald Watt, Service Manager for Resources in Argyll and Bute Health and Social Care Partnership, which includes care homes, care at home and older people's day services.
Thank you both. Nice. I appreciate the time and effort that you can give to us here. We are involved in a short life working group based upon safe and effective staffing, particularly over the winter months of 2021 into 2022, when, as we're all aware, the COVID response has meant that the effect on staffing within services has been quite acute. Therefore, this is a webinar based on discussion points around the pressures of staffing just now and how we can hopefully mitigate those. This has been presented by a collaborative way by the Care Inspectorate with CCPS and also with Scottish Care. So I'm just going to share my screen so we can have a look at some of the issues that we're discussing here. As I mentioned, this is a collaboration between the Care Inspectorate, CCPS and Scottish Care with the intention of looking at safe and effective staffing across the sector. What we're going to discuss today is recruitment. We're going to discuss some supporting staffing issues, contingencies, and a collaborative communication ethos that's been developed across the agencies. So, first of all, in relation to recruitment, I wonder, Jamie and Donald, if we can just talk a wee bit about some of the issues that have been facing you. So, how have you been able to recruit to meet the needs of the residents and service users across your area during the pandemic?
I think, Simon, it's been quite a challenge for us. Obviously, we know there's a lack of carers nationally, and in Argyll and Bute, we're no different. That's affected us the same as other partnerships. I think we've had to look to be quite creative in our processes for recruitment. So some of the things that we have looked at are a strong emphasis on partnership working, so working together with the wider health and social care partnership staff, utilising social media. Our communication teams have been excellent in both NHS Highland and Argyll and Bute Council, and working with them to try and get recruitment of any posts that we have vacant across all of our sectors out in a timely manner, and focusing these as care, as a good place to be and work. I think probably I want to pick up an example. We had a care home on one of the islands who had a number of vacancies, also incorporated sickness and maternity leaves, and small island, small home, minimal staffing, and we were really pressured in that. So I suppose picking up the partnership working side of things, we got together and actually at one point we're meeting on a daily basis. I suppose that's partnership with the Care Inspectorate, Scottish Care, Jamie as the lead nurse, local managers and the wider island services, so our GP practices, and we also included some of their voluntary trusts that they have on the island, and we work together to look at solutions to staff the home safely. So definitely that wider partnership approach has certainly worked for us in Argyll and Bute.
Excellent. Okay. And in terms of the services as well, I mean, it's something I suppose we've spoken about during our collaborative meetings. It can often be a sort of a sensitive topic because when it seems to me, from my point of view as a relationship manager with not only Argyll and Bute but across a number of different areas, it can be difficult at times when there is a rolling recruitment drive, not just from the HSCPs but from other services as well. And, a lot of services, a lot of providers, a lot of HSCPs are trying to recruit the same people, so it can be difficult. And I think you would probably agree, isn't it, when we have a number of organisations looking for the same people to do the same job, and what seems to be an ever dwindling number of people that are out there just now willing to work in the sector.
Yeah, absolutely. And I think we've worked in partnership, I suppose, with our independent providers in care homes and through in care at home. we have a large number of independent providers for care at home in Argyll and Bute, and we have, where we have internal services as well, we have worked collaboratively with the independent providers to allow them to go ahead with their recruitment, to give them a period of time to try and get recruitment settled before we would then advertise any internal posts, because at times it can be seen as a more lucrative option. But so we've done that and worked in partnership with them, and I think they've appreciated that. I think we've all, the other point probably, we met with all our independent care at home providers and had these discussions around this current situation around recruitment, what we could do as a partnership to support. So we are looking at that wider recruitment as a partnership as well to support the independent providers.
Okay, thank you. I'll move on then to look at supporting staff, and I suppose for me, well-being has been a watchword across the entirety of the pandemic, particularly I think during given the remote nature of these new working practices that we've now become used to, and obviously the pressures that have been across the entire sector. How have you been able to respond to the health and well-being needs of your staff within your local area?
I would say, and within the partnership, Argyll and Bute Health Social Care Partnership, it's a high topic agenda at the number of meetings you go to. We have a daily huddle. We talk about well-being at that on a daily basis, and reminding managers of what they can do to support their staff. So some of the things we have are a well-being Wednesday. So there's communication goes out every Wednesday from both Argyll and Bute Council to their employees and NHS Highland to their employees, just pointing folk to the staff to resources that are available for them. We also look at the independent sector leads that we're also talking about that, and we share, I suppose it's not just for our internal services in the partnership, we've shared that wellbeing, access to these wellbeing services across all our independent services as well, sector, sorry, as well. Mm-hmm. I think it's been mindful of your own staff's personal situation. You know, a lot of folk are working at home, which technology is great when it works, but there's definitely a feeling of isolation for those that potentially live on their own, and we have to work with them to try and have that balanced approach and potentially come into the office a couple of days a week to break that up. If you live and work alone, it can be quite isolating. So, but yeah, it's
a challenge, I feel, isn't it? I mean, particularly in relation to technology. I think we've been, on one hand, we've been very fortunate, and I know that we have, particularly within the caring spectrum, within the teams that I've been involved in, we have mentioned on a number of occasions, particularly at the beginning of the pandemic, how fortunate we were that we had technology such as Teams set up and ready to be used at that time, because obviously not only was our working lives turned upside down in March 2020, but every aspect of our lives were turned upside down, and not being able to physically leave the house was a huge thing and hugely new thing for everybody. So having the ability to check in, I mean, I know that my team, certainly we were checking in on a daily basis at that point, and it was having the ability to see each other, even though you couldn't do it face to face, but having the ability to do it via Teams was a great benefit. But we also have to then, as the weeks and the months and the years now of the pandemic have went on, we have to keep in mind as well about the pitfalls of constantly being in front of a screen and constantly being available when we're working at home. And it can often be difficult when there's not really much time is set between meetings, and you feel as if you're potentially not able to achieve some of the things on a to-do list that you maybe once had at the beginning of each day, due to the fact that you were just constantly jumping from meeting to meeting to meeting. And we've been very mindful of that in our communications with services over the pandemic, is about the effect that having those meetings with providers can often have in relation to the pressures that they maybe have between meeting the basic care needs of people within homes and services, as opposed to being on meetings with other people. And at the same time, that it's very important that we're able to share information and share the guidance and have discussions about it where necessary. But at the same time, that's where we have to draw that fine line between using the good technology and also the pitfalls that it can often bring along with it as well. We'll go on now to talk a wee bit about contingencies. be interested in hearing some of the contingencies and plans that have been created in order to ensure that support's maintained across Argyll and Bute.
So one of the things that we've done is the development of our priorities for safe care document, and the purpose of this is to support registered managers and their teams in a time of significant shortage of staff or other pressures. And it kind of outlines the key responsibilities and how to maintain all areas of essential care. So that document has been created and shared with managers across the area, and support's available to help them implement that if needed. And we've also developed an escalation plan that sits alongside that, so they work together.
And the escalation plan, how does that? I wonder if you can just tell us a wee bit more about how that
Yeah.
helps in terms of the services that's maybe being aimed at.
Yeah, so the escalation plan looks at how we support as a wider organisation, how we can support a service that has a particularly fragile staffing situation, and it's a step-by-step process looking at the initial steps taken by the registered manager and the operational team in that area, with steps all the way through to escalation to the care home oversight group and the chief officer and nurse director. And it helps us to work in a sort of systematic way in times of challenge to ensure all possible solutions to ensure staffing are looked at. Thanks.
And is that something then that services are? It's been signed off, isn't it, now in relation to being a document that's been developed by yourselves? But now, what stage are we at now in relation to getting that out there to the providers in order for them to be able to use that tool?
Yeah, so I'm meeting with them via the independent sector lead next week to discuss that further and to implement that with them.
Excellent. Okay, that'll be good for people to then to see that in the coming weeks in order to be able to use it, because as I say, it's still an ongoing issue, isn't it, in relation to the staffing issues that we are facing. The last part of our discussion today is about collaborative communications. So I suppose how do you think that communications have changed during the pandemic, and has a more collaborative approach been beneficial both across the locality, locally, and also across the HSCP as a whole?
I think in general, yes, there's been an increased communication and an understanding of folks' roles. I think, Simon, across the HSCP in general. I think with the assurance meetings that we pulled together initially for care homes, and that now incorporates care at home, we've got a wide sector from the locality and out with of Scottish Care Inspectorate, lead nurse. We have a professional lead for social work, head of service. So we're working in partnership, and I think we've broken down a lot of barriers and relationships, and partnership working have certainly improved with these daily meetings. Obviously, they step up and step down depending on what's the situation is in Argyll and Bute at the time, but certainly sharing that on a daily basis, sharing information, sharing and listening and taking advice on a daily basis has really been helpful, I think, to the partnership.
Yeah, I'd agree. I think it's really important to emphasise as well as that sharing of information is solely intended to drive improvement and to support that the services across the not only your area but across the entire country, where information has been shared between ourselves and HSCPs and services, so that we can ensure that the correct supports are going to the correct people at the correct times. For me, it's been one positive that has come out of the pandemic has certainly been that collaborative approach and greater working relationships that have been developed between ourselves and various agencies, where we maybe once knew of one another, but we weren't particularly we didn't have the same routine and regular discussion points that we have now, and the ability to pick up the phone and say, right, okay, we have the situation in this area, let's see what we can do to help resolve and to ensure that first and foremost that the outcomes of the people that are being supported and the services are maintained, and where we can dip into expertise that's out there. It's been a great benefit, I think, from my point of view. Okay, thanks for that. That really brings it to an end our short bite-sized session today. I'd like to thank Jamie and Donald both for your contributions. It's been greatly appreciated. As you can see on the screen here, we have there is a link that's available to the winter staffing planning guidance that's out there. And if there are any questions, please feel free to get in touch. And we hope this has been of benefit. Thank you.